6 weeks since my initial treatment, and I'm getting ready to go to the doctor today for my follow-up. I can really feel that my cheeks are much fuller. I don't have that sunken that I had before. Very pleased.
How are you doing?
I'm doing great.
Okay. Any complications from the treatment last time?
None at all.
Okay. Much in the way of bruising?
A little bit of bruising, not very much.
Okay.
Like right here, more swelling than bruising.
Okay. How long did the swelling last?
Probably 5 days, 6 days.
All right. So during
But
that...
not to where I couldn't put some makeup on and go out.
Okay.
That probably 3 days.
Now what about the scar up here? Did you notice a difference?
I think it's much better.
Mm-hmm.
And the Botox that they did?
Yeah.
Big
Okay, so it did help. Yeah, definitely. That's
big
right.
difference.
Right.
I have had several comments like, gosh, what if you look great? Are you using, have you been getting more rest or not? In the context of what have you had done? Just, you really look good.
Yeah. I mean, what I see is still this. You know, you still have these lines. Yeah. That's the first thing that I see when I look, is that these marionette lines are still there. Not as much as before, but definitely still a little bit. And I do see this contour irregularity. What I see is kind of a line here and then a depression below it and a little bit above it, and that we can soften up. I still see a little bit of depression in here, but mainly that's what I see.
These and this one.
And I still want to go after this area to try to soften up that scar. You will, with Radiesse, you will feel some nodularity in the skin, which eventually over time will soften up and go away. But what this tells me is when I inject, I'm going to inject below this just to smooth that in. So a very small amount of product right into this space, right where the red-white border is. And it's done. I'm going to use the tip of the needle just to point it. A little bit of filler right there, starting here, going right up on the vermilion border, and on the lower, same idea. So what we did today is we used 2 syringes of Radiesse, and the areas that we treated, just a little bit up here, again underneath that scar to soften it up so it won't be so apparent. So the Radiesse is actually right in here, a little bit in this nasolabial fold, a little bit over here, tiny amount just at the vermilion border on the top and bottom of the lips, and then most of the treatment was really done in this area to soften up this marionette line. And you can see, you know, there's still lines there, but they're not as apparent as they were before. And finally, I also treated this area out here where you had some deeper lines, especially when you, with facial expression, where you really had depressions in there. And so that's the area that we've treated.
My skin is so smooth, and I'm very happy.
I hope that this video answered some of your questions about facial fillers. If you have other questions, feel free to call or email us. Thank you for watching.